Good afternoon, everyone, and welcome back to this afternoon session. We have conference about the ASTERASYS company. I hope that you have a chance to network to our other company and recharge during the break. Today we have the lineup of many speakers and insight ahead the rest of the day. Today, our topic will be about the lifting techniques with the multiple devices. Okay, without further delay, I will drive you to the next section with our speaker, Dr. Thanyawalin Chodchop-Padit. In a distinguished physician, the visionary founder of Thanyawalin Clinic, graduate with the honor and specialized in anatomical pathology from Faculty of Medicine Lama Hospital, Mahidol University. She seamlessly bridged deep cellular science with advanced aesthetic medicine, renowned for her expertise in multimodality facial harmony. She uniquely applied her pathological insight to analyze dynamic tissue alteration induced with energy-based devices to mastering high-flow and monopolar RF technology. She precisely manipulates tissue remodeling to achieve optimal lifting and firmness results, combined with her master-level technique in advance of filler injection and also biostimulator, deliver sophisticated, highly tailored, and long-lasting facial rejuvenation. Please warm welcome to Dr. Thanyawalin.
Thank you, Dr. Setawut, and good afternoon, everyone. This is my pleasure to share our experience with Cutera, a combination of Liptera microfocus ultrasound and Coolface RF. Today, I would like to focus one key concept. Facial rejuvenation should be anatomy-driven. It is not simply about delivering the energy. It is about delivering the right energy to the right anatomical layer with precision, safety, and reproducible clinical outcome. Throughout this presentation, I will share how we utilize layer-specific energy design to achieve lifting, firming, and comprehensive facial rejuvenation. Next. Let us begin with Liptera. The objective of microfocus ultrasound is to generate a thermal coagulation point that reach approximately 65 degrees Celsius, create immediate connective tissue contraction. What makes Liptera different? The TDT technology make it different. Unlike conventional high-flow, energy is concentrated at the focal point while minimizing unnecessary heat above and below the target. This significantly improves patient comfort and safety. Another advance is UDP version number 2. It is a fractionated energy delivery into multi-state. By the combination of both technology, the patient has more tolerance, less pain, and maximum lifting effect. One of the most important innovations of Liptera is the pen transducer. Most lifting devices perform very well on the flat surface. However, facial anatomy is not flat. Many important treatment areas are curved, narrow, and anatomically complex. Example, brow tail, forehead, periorbital region, nasolabial fold, marionette area, neck, and especially malamouth. The pen transducer allows us to follow this curve precisely. For the malamouth patient, I often perform circular and spiral treatment pattern using the pen transducer. This creates excellent soft tissue contraction, fat compaction, and tissue tightening. In my practice, this is one of the most effective indications for the pen transducer and often produce highly satisfied clinical outcome. Today, many patients come to my clinic and dissolve a big filler in the cheek and malamouth. Immediate contraction is want, so I use the pen transducer to treat the sagging from over bulging from the filler. To understanding lifting, we must understand the anatomy. We are not treating only skin. We are treating the retaining ligaments, fiber septa, fat compartment, somat, and dermis. Different structure exist at different depths. Therefore, treatment depth should always be selected according to the anatomical target rather than using the same protocol for every patient. Anatomy determines the energy selection. And this is how I approach the energy delivery. At 4.5 mm, I primarily target SMAT and the deeper retaining ligament. This layer provides structural lifting and contour improvement. 3 mm, I focus on the fiber septa and fat compartment. This helps compact and repositioning the soft tissue, particularly in the malar region, jawline, and submental area. 1.5, I target the dermis. The layer is responsible neocollagenesis, elastin remodeling, and skin tightening. Although we have protocol, I never treat patients using fixed setting alone. I always adjust energy level according to the anatomy and patient feedback. Pain feedback remains one of the most valuable real-time safety indication during treatment. Precision must always be accompanied by safety. When performing ultrasound-based treatment, understanding facial nerve anatomy is essential. The high-risk area, I avoid excessive pressure and excessive the energy. One practice technique I frequently use to shift, lift, and then shoot. By gently pulling and shifting the skin before filing, we can create flatter treatment surface, improve anatomical accuracy, and reduce unnecessary risk around the critical structure. This technique is especially useful around the nasolabial fold and outer curve area as jaw. Let us move to the cool-phase monopolar RF. Unlike focused ultrasound, RF generates volumetric heating throughout the tissue. The target temperature is approximately 50 to 60 degrees Celsius. Stimulate the collagen remodeling and fiber septa contraction. The key feature of cool phase is DCC, the direct contact cooling. This technology protects the epidermis while also influence the depth of energy penetration. It means cooling is not only for the safety. Cooling becomes an anatomical cue that help us determine where is the energy delivery. One concept I want everyone to remember is cooling control the depth. Higher cooling level protect the surface more effectively and drive energy deeper. Therefore, I use higher cooling level setting for the posterior cheek and deep fiber septa, anchoring ligament to lifting and contouring zone. Lower cooling level allow more heat to remain superficially. This makes them ideal for periorbital rejuvenation and for head tightening and superficial skin remodeling. In the other words, we are not only adjust the energy, we adjust treatment depth through the cooling setting. Fiber septa remains one of the most important RF targets. For the posterior cheek treatment, I use deeper setting. With higher cooling for the malar region, I combine superficial and deep passage because the anatomy is more complex. The delicate area as a lower eyelid and neck. Avoid the midline. I use more superficial setting. The simple but important technique is tap and fix to stabilize the skin, help maintain the correct anatomical plane and improve skin consistency. And this is my setting for the superficial and for the deeper part. Now we arrive at the most important concept of today's lecture, why combine Liftera and cool phase, because each technology addresses different layers. Liftera provides precise focal contraction at the select anatomical depth. Cool phase provides volumetric heat across multiple tissue layers, one lift and one firming. Together, they create comprehensive tissue remodeling from retaining ligament, SMAT, fibrous fat compartment, and dermis. As why we call the concept Cutera the true all-layer rejuvenation strategy. The two complications we want to avoid are ulcer and burn. Ulcers are usually related to incorrect depth selection or poor cupping gel. Burns are generally associated with excessive heat accumulation or inadequate skin protection. proper anatomy, appropriate energy selection, adequate cooling, and patient comfortable monitoring remain the key principle of prevention. This case demonstrates immediate lifting after treatment. Only one side, you can see how appreciate improved jawline definition, better mid-face support, and facial contour enhancement. This immediate change reflects connective tissue contraction at the target anatomical layer. And this is multimodality approach. Next. In the patient with big chubby face, increased treatment density can further enhance contour and lifting. This case demonstrates the improvement important adequate energy delivery when treating the large soft tissue volume. If compared the before and after result during only Liftera that show clear lifting and slimmer face. Now look at these two photos. This is immediate result of combined Liftera and cool face. What stand on out? Here is how plump, radiant and fresh skin look. Keep in mind that the full result will take about 2 months after it completely show you. This is one of my favorite pain transducer case. The patient received 3,000 dots on the face and 3,000 dots on the submental region. Why? Because they more curved, more complex. So I favor pen transducer. After only 2 weeks, we can already appreciate improved in-cheek contour and under-chin tightening. The ability to follow curved anatomical structure is what makes the pen transducer particularly effective in this patient. And this video, I want to focus on the pen transducer for the delicate area, under eye, temple, brow tail with tap and fix technique. In this zone, our target is neocollagenesis for the skin tightening. Moving to the jawline and the posterior cheek for the fibrous septa and SMAT, it makes contraction and lifting. Finally, the buccal fat pocking, and under chin, we are target the fibrous septa to achieve contraction by the pen for the complex anatomy, precision and safe. You can choose pen only or combine the pen and lines transducer in the same time. And this video, I want to demonstrate cool face treatment. When working on the delicate area, we want the energy to remain superficial. Therefore, we set the energy level at 7 and the cooling level only 3 because I use more superficially energy deliver. If the skin temperature is high, you can move the probe without shooting for skin cool down because DCC is continuous working even not shooting the energy. However, when treating the buccal fat pocket or the jaw, the target is more deeper. I drive the energy go deep, so we need increase both energy and cooling level. Because the DCC, you no need the gas. This patient has been maintained over 2 years period using combination of energy-based device, PLLA, filler and botulinum toxin. The objective is not the transformation, the objective is preservation. Preserve tissue quality, facial harmony and natural appearance over time. This is the philosophy of the modern facial rejuvenation. And the 10-year journey illustrates an even more important lesson. Aging affects every anatomical layer. Therefore, successfully rejuvenation requires a personal combination of multimodality over time. Filler for the restore the support. Biostimulator improve the skin quality. Neuromodulator balance muscle activity. Energy-based device maintain the tightening and collagen remodeling. The goal is not to make a patient look different, but the goal is help them age beautifully. Finally, I would like to share a very relevant case of GLP-1 and tirzepatide therapy. This patient lost 13 kilograms. Weight reduction is benefit for health, but rapid volume loss often leads to facial deflation and tissue laxity. Challenge is not helping patient lose weight. Challenge is maintain facial structure during the process. My approach is always layer by layer, structural foundation when necessary, muscle balance with toxin, and tissue tightening with energy-based device. Facial rejuvenation is an art guide by anatomy. When we are treat every anatomical layer appropriately, we can achieve natural outcome even after significant weight loss. By the way, Liftera provide precise layer-specific lifting. Coolface provide volumetric firming and skin tightening. Together as Cutera, they allow us to deliver true all-layer rejuvenation with safety, precision, and reproducible outcome. Because ultimately, successful rejuvenation is not about delivering the more energy, but about delivering the right energy to the right anatomical layer. Thank you very much.
Okay, thank you for your informative lecture from Dr. Tanyavarin. Okay, if you have any question, we have the Q&A session after all the lecture from our speaker. Please keep it in your mind because we have a little bit delay of time. So we have the next speaker. Okay. We have the next speaker, Dr. Park Young-jin, the aesthetic dermatology expert and global opinion leader. He is aesthetic dermatologist from the Republic of Korea, widely recognized as global KOL, international trainer, and clinical researcher. He is the president of the Off-Lead Clinic Network, which span in three international clinic sites across Incheon, Bangkok, and Seoul. He is an incredible active educator and researcher. Dr. Park had delivered over 90 invited lectures globally between 2023 and 2026. His speaking engagements span major international stages, including AMWC Monaco, IMCAS Paris, ASLS across Asia. Please give our warm welcome to Dr. Park.
Thank you very much. Today I'm going to explain of a new device called CoolSonic, which is a HIFU with accelerated cooling system together, such as similar to SoftWave you can think of. So the basis is that when using a HIFU, normally the pain is the ceiling of the energy, meaning that when the patient feels too much pain, then we cannot increase the energy. But actually, to have a right lifting capacity, we have to have the right amount of energy to achieve the right effect. So when we are using HIFU, so what does it that when people feel a lot of pain, then we try to lower the energy because we don't want to give too much pain to the patient. But as you know, that will actually decrease the effect of the HIFU, and we will not be able to achieve the right amount of lifting effect that we want to have. So when we see the HIFU, it's actually using the focusing system. So we want to make a focusing coagulation point to one point in the right layer, such as 1.5, 3.3, 3.0, and 4.5. So meaning that we want to, in different places, we want to achieve the right amount of coagulation point in such point. And to do that, we have to have the right amount of energy. But there's three types of pain using HIFU. First is when we get into the dermis. And because of the nerve system in there, when the energy goes in high, there's a sharp, very sharp pain because of the nerve system. And the second pain is when we use a very deeper transducer, such as 4.5. When it hits the bone, the HIFU actually gets reflected to the bone, and we have a little bit of a very heavy, dull pain. But the last one is most important. The last pain is actually when we're using HIFU, even though the HIFU is highly focused, the energy will spread. And when the energy spreads and the shot rises, the energy will spread to the heat will spread to the dermal layer, and we have a little bit heating sensation. So that's one of the reasons when we increase the shots and the shots accumulate, the patient start to feel more pain. And this is one of the reasons of a lot of downtime, and one of the reasons we decrease the power when we increase the shots. But as you know that when it works, HIFU is a very good a device that we can use in the market to give a very good effect, but the pain is the tolerance that we cannot use. So that's why we try to undertreat. And for the biophysics, HIFU, as I told you, it's an intensity that focally gives energy into one specific spot. But there is not only that, because as I told you, the energy will actually heat will spread. So that's why when the shots accumulate, there will be accumulation of heat in other layers of the parts that we actually don't treat. So neocollagenesis happens, and as I told you, especially in Asian patients, heat accumulate even further. So that's why, especially in South Asian patients, where normally Fitzpatrick type will be 3 to 5, and with more melanin components, heat actually accumulates faster in the dermal layer because of the melanin component. So that's why cooling now is very important nowadays. And ACC is an active conduction cooling that is produced by ASTERASYS, which will give minus 10 degrees cooling, continuous cooling when using HIFU. And what helps is that, as I told you, there are two pains that was happened by HIFU. When there's a focal point, there's a one pain sharp and dual pain from the bone, but there was one more pain, which is the heat that's accumulated after shots coming up and up and up. And this pain can be decreased by the cooling. But some doctors might think that if there's cooling because the reverse thermal gradient, maybe the HIFU will not heat the right layer, but actually no, because even there's the contact cooling, HIFU still hits the right place. So you don't have to worry about the HIFU going into different place. It will hit the right layer, but just saving the epidermal part of the increase of the heating process. So when it's compared to with the HIFU that was active cooled and HIFU that was not cooled, you can see that only with the cooled HIFU, there was no ecchymosis and no epidermal damage, meaning that there will be less downtime for the patient, especially because when you use a very high power, high fluence with the HIFU, you see that patients sometimes become very puffy, and there's a lot of redness after the treatment. And some patients actually have the redness for a certain amount of time and complains about that, but that's normally happen because of the accumulation of the heat. And accumulation heat actually generates the damage in the other part of the tissue that you actually haven't treated. So what happens when there's cooling on the turbine? The TCP, which is the coagulation point that you want to achieve, will be still there, but the surface pain will decrease, and the energy you can increase, or you can use the same energy even though the shot accumulates, because the heat that accumulates will be lower, and the target that you're using will be still there. So meaning that there will be the right effect, and the effect will be still there, but there will be less downtime and less complication that might happen from the HIFU. So the cooling that we get from the surface is that we get less burns that might happen of the accumulation heat, and there might be less PIH, because sometimes if there's too much heat to the patient, they might actually end up having more melasma. So sometimes when we use monopolar RF or maybe very high energy for the HIFU, you might have to decrease the power in those areas. But actually with the cooling of the epidermis, you don't have to worry about too much heat, because the heat jet is generated in the epidermis will decrease and decrease the pH that will happen. And especially for the epidermis saving, especially for 1.5 energy. Because as you know that, for example, when you, even for maybe therapy, you only use 0.2 joules for the energy for therapy for 1.5. It's because there might be high chance of getting burning or complication, because the heat will be going to the surface as well while the shot accumulates. But when there's cooling, this will be decreased, meaning that you can use a higher power, especially for 1.5 or maybe 2.0 for the dermal layer to enhance the dermal thickness. So the cooling will help to decrease the climbing of the temperature of the tissues that you haven't treated. And the energy, so you can use more energy, or maybe you can use the right energy. You don't have to decrease the energy when the shots accumulate. So ACC does not change the coagulation point, but it will decrease of the complication and the pain sensation that comes after. And the cooled epidermis also de-risks the effect, and the efficacy is still there. And also because of the collateral heat, as you know that when there's collateral heat means there's more damage in the tissues because of the thermal energy that was gathered even further because of the HIFU. But with the epidermal cooling, it will be decreased. So that's why collateral injury will be lost, and you will be having the energy only in the places that you want. So the pain that climbs will be decreasing and surface risk will down. And because of that, downtime will decrease a lot. So this is one of the good points of the epidermal cooling and the contact cooling. And also when we use the shot, as I told you, normally when the shots accumulate, we try to decrease it because of the pain sensation and because of the redness of the face of the heat accumulation. But throughout the whole face, we will be able to use the right amount of the energy to get the right amount of power. So Coolsonic, I think in general sits between Ulthera and Softwave, because as you know that Softwave only hits 1.5 depth, but Coolsonic has 3 tips, which is 4.5, 3.0, and 1.5. And Ulthera and other HIFUs does not have this cooling sensation. So that's why Coolsonic is one of the HIFU that you can choose to use to decrease the complication and increase the power with the effect and decrease the pain as well. So for patients, normally I use all types of tips. Normally I use mostly 4.5 and 1.5 with the main, and sometimes I use 3.0 to decrease the fat for some people to have the lower facial jawline enhancement as well. So this is only after 4 sessions normally, after 4 weeks after 1 session. You can see that there's a little bit of enhancement, but you can see that for these kind of patient, it's only 1 session after 4 weeks. You can see that the jawline becomes a lot better. And one of the things is that when you see the background, the photo color is not that different, but you can see that the facial color of the patient is different. It's because that they have a dermal enhancement, meaning that you can use higher energy, especially for 1.5 millimeter depth, meaning that there will be higher dermal enhancement for the patient, not only about the lifting, it's also good for the dermal enhancement, meaning that the dermis will be a lot better than before. So it can be used with that. And also for double chin as well. This is after actually 3 sessions, 1 month apart. And you can see that the enhancement of the submental cheek is a lot, and there was no photo any change. Actually, the patient had decreased a little bit of weight loss, about 30 kilograms of the weight loss using Mounjaro. But you can see that even with the the weight loss plus the HIFU, there will be less. Especially people with the using Mounjaro and Wegovy, you know that there's a lot of sagginess, because now we found that we say the Ozempic face it's not only about the weight loss, because when you use Ozempic or Wegovy or Mounjaro, you also have the loss of the collagen because of the injection. So that's why you had to combine with these kind of treatments together to decrease any kind of sagginess that can happen throughout these injections. So you can sell it together with the patient. So as I told you, the patient comfort increases a lot, and the effect is better because you don't have to decrease any power. And the doctor, as a physician, you will feel more safer because there will be less complication, less downtime, especially for the patient. So cooling the surface and treating the right depth will get a very good effect for the patient, and with the decrease of the pain and decrease of the complication. Thank you very much.
Okay, thank you, Dr. Park, for your useful information that we have learned that HIFU is very effective, but the problem of the HIFU is the pain. So if it will be better if we have the machine of the evidence-based device that it will be prevent the pain with ACC without any cost of the consumption of the gas, with the don't change of the, and moreover, it will don't change the coagulation point to prevent the ecchymosis, less PIH, and more, less skin damage. Thank you for Dr. Park. Okay. And also, if you have any question, please don't hesitate to ask in Q&A session. And up next, we have the Dr. Yesin Lai. Dr. Yesin Lai is the Indonesian medical doctor and skin laser expert. He practiced at Clinic MT Haryono, where he specialized in advanced non-invasive cosmetic treatment and anti-aging therapy, and also regenerative medicine. He holds a Master of Management degree alongside his advanced training in anti-aging medicine. Dr. Yesin Lai is recognized speaker on international aesthetic circuit, includes ASLS Korea, MCAT Asia. Beyond his practice, he also an active digital creator, healthy lifestyle influencer along Instagram and YouTube. Please make an applause for Dr. Yesin Lai.
Thank you so much for a nice introduction, Doctor. Okay, so hello everyone. So my session is about combination HIFU and monopolar RF. So it's the same topic with the previous speaker, Dr. Tanya Warin speak about combination of monopolar RF and HIFU. Of course, today I'm gonna give another perspective about this combination, and I'm gonna share my technique, what my parameters, and the thoughts behind why I'm choosing these both devices. So I will start with this one. I do not know in your country, but in Jakarta there's a major shifting of trend in aesthetic medicine. This is the current landscape in Indonesian aesthetic business. So the market behavior is the important point for me and my team in consider choosing which devices and what kind of treatment that we're gonna have in our clinic. Till now, me and my team, we are running 5 clinics around the Jakarta. And I understand every doctors want to do the best for their patient, right? But unfortunately, not all the doctors pay attention to the market shifting trend. Why? Because it's related with the treatment that we want to impose to our patient. Indonesia is also the same. Jakarta especially, there are shifting trend among the patient where patient now more open mind about having surgery. So many patients now, in terms of facial lifting, they are seeking for facial surgery. There are certain countries, the most favored for having plastic surgery. One of them is Korea, and the second is Vietnam, and Indonesia is the third. Besides, and the top 3 of trend for plastic surgery is rhinoplasty, blepharoplasty upper and lower, and facelifting. Besides the surgery, now the aesthetic treatment more focused on skin quality. That's why in Indonesia now the many products coming, especially from Asia and Europe and America, focus on skin quality like skin booster. Since it's increasing the number for surgery, for the demand for dermal filler significantly decreased. So now the patient seeking for dermal fillers only for specific area like on chin, on the lips, and a little on temple. Dermal filler for mid-face lifting less favor now since the campaign of overfill syndrome. We used to having a perform dermal filler for mid-face lifting using a certain amount of volume, and it costs a lot of volume. So now in Indonesia, patients start to compare. You know, if we use a high volume of dermal filler, it's costly. And the patients start to compare the price they should pay compared to surgery. So that's why dermal filler in Indonesia decreasing a lot. And that's suffering for some distributor who already bringing dermal filler, certain brand to Indonesia because it's decreasing a lot. Even though a well-known dermal filler from Europe, they also facing the same condition also. But still there are many patients cannot having a surgery because of medical issue, like patient with uncontrolled diabetes, patient with hyperimmunity or autoimmune. They cannot have a surgery as simple as that, okay? And still, there are many patients have strong aversion going under surgical procedure. So for those patients, they are seeking for non-surgical facial lifting. This is the market for us as an Indonesian aesthetic doctors. But the patients still demand for direct visible result and little or no downtime. That's become our homework, how to perform facial lifting with direct visible result. Okay, so it comes to me and my team comes to choose this Cultera as a modality for skin tightening and skin lifting as a bridging a combination, as a bridging from the injection and a surgery, because both device utilize effective, manageable, consumable, ensuring competitive clinic pricing strategy. As you know, it's very tough competition between aesthetic clinics, so we need to perform a treatment that keep saving the margin for clinic operation. So we come to the basic theory of synergizing HIFU and RF. As we know, as the previous speaker already talked, that HIFU work as creating thermal coagulation point in the deep dermis and SMES. That's the target of HIFU. While monopolar RF work as a create heat to the dermis, and while the dermis is heat, it's going through an inflammatory pathway, control inflammatory pathway, then resulting a skin regeneration. But still, because the inflammation pathway need a time to giving the result. Like if we using monopolar RF, it takes at least 2 weeks so the patient can see the result. But how about this? Patient always want a direct visible result so they can ensure that the treatment work for them. So this is my models. We do this Cultera treatment and the result within 2 days. If I want to create a visible result, my point is working on the deeper target like SMES. Because the upper layer like skin, once again, need to going through the inflammatory pathway. which is it need 2 weeks. So from this result, it's always coming from a deeper layer, which is smash. In order to having a significant visible result, we need a clinical optimization. From HIFU, the optimization can achieve by targeting temperature around 60 under 75 degrees and can instantly denaturate collagen and cause immediate smash contraction. This cause a visible result from this smash contraction. To achieve this temperature, it can get by optimal level of energy and total shoots. This is my parameters for the HIFU. Total shoot 400 until 500 at cartridge depth 4.5 and 3.0 millimeter. I do not use 1.5 because once again it's combination with monopolar RF, so I rarely use 1.5 millimeters. And the area is limited only on the mid and lower face. The power energy for 4.5 cartridge is 7 to 8, and for 3.0 cartridge, I use the energy level at 4 until 5. The second clinical optimization is about anatomical mapping. As we know, during the age, there are certain changing in our face. There are hypertrophy part, which is the tissue become thicker, subcutaneous fat become thicker, and structurally pull up shaking compartment. And there are also an hypertrophy or atrophy part and a certain part of the face. For the hypertrophy part, we choose a deeper cartridge, 4.5. For the atrophy part, we shoot more using 3.0 millimeters, and we shoot more using monopolar RF. Just imagine this yellow line is a line that divided our mid and lower face become hypertrophy and hypotrophy part. Also, this line divided the static and mobile area. As we know, in the medial part, during age, this is a hypertrophy. And the lateral part is a atrophy. So this yellow line actually is masseteric ligament line. The position just in front of masseteric muscle. So if we observe our patient in certain age, we can see in the medial of the masseteric ligament, there will always a hypertrophy fat over there. So targeting the fat using a deeper cartridge, 4.5 millimeters. For HIFU in 4.5 millimeters, sometimes we not achieve the smash. But the heat that accumulated on the fat make the fat dissolve, which if we work on the hypertrophy area, that gives us advantage, become the fat dissolve and slimmer, and the contour of the face become even from the medial to the lateral part. So this is the masseteric ligament line, just in front of the masseteric muscles. And also, the upper part is zygomatic ligament. This is the maximal upper cheek lifting factor that should be anchored based on the zygomatic retaining ligament. And this is the liftera area. I only use liftera or HIFU on this area. And while using monopolar RF for the whole face. Okay, so this is video. The middle line is masseteric ligament line. So this is the hypertrophy part or the mobile area. I choose a deeper cartridge, 4.5 millimeters. I shoot more on hypertrophy area compared to atrophy. I still use 4.5 on the atrophy part, but I shoot much more on the hypertrophy area. Clinical optimization number 3 is using monopolar RF to maximize the neocollagenesis and skin quality improvement via control minor inflammation. The target total, if we should achieve energy from 35 to 45 kilojoules. And epidermis should be protected with sufficient cooling system. As Dr. Tanyawarin already explained, this is a direct contact cooling from the cool phase. It prevents the epidermal from getting burned. And additional cooling can be used also, usually using a mobile cooling system. This is my parameters to achieve total 35 until 45 kilojoules, the level around 7 to 8, using maximal cooling. The shoot 300 until 400 shoots, 2 until 3 passes, 110 until 20% overlap still okay, and adding conditional cooling if necessary. So from 300 shoots level 7, we can see we can achieve a total energy delivered 35 kilojoule. And the endpoint is little erythema, usually can disappear within 24 until 48 hours. Okay, this is how I did the cool phase. Two until 3 passes will be okay. So the focus is to achieve total energy, to create skin lifting. So, once again, to achieve this result, we can acknowledge that, of course, this is achieved by contracting the somatic tissue, not the skin. Skin getting better need more time, at least 2 weeks, because once again, it coming from the inflammatory pathway. So, about Cultera, it is a synergizing Liftera HIFU and Coolfish monopolar RF. This is filling the market gap between injection and surgery in our perspective, in our patient in Jakarta. It's suitable for Indonesian clinic business expectation because we need devices that can handle in this competitive market condition. Optimizing Liftera is in targeted level, total shoot, certain area should be important. Optimizing cool phase by achieving target temperature 35 until 45 degrees from 300 until 400 joules. So, thank you.
Thank you from Dr. Yasin Park. Besides from the combination of the treatment of the energy-based devices with the HIFU, with the monopolar RF, we learn about the expert perspective of the from Indonesian side in about the aesthetic market behavior and about the surgery also interesting. And also, if you have any question, please keep in mind first. And okay, we will move up next to our last but not least speaker, Dr. Rodney Valerio from the Philippines. He's an aesthetic physician of the Barrow Medical Group, and he is a result-driven aesthetic physician based in Manila, Philippines. He specialize in a wide range of transformative treatment, including skin booster, neurotoxin, dermal filler, and advanced laser therapy for anti-aging, melasma, acne, and also skin rejuvenation. Dr. Valerio is highly involved in clinical research and protocol development, frequently pioneer new combination of energy-based devices. His credentials include advanced training from Press Summit in Athens, IMCAS Paris, and also IMCAS in Bangkok last year, and facial anatomy cadaveric masterclass in Thailand also. Please welcome to Dr. Rodney.
Okay, good afternoon, everyone. Okay, I'll be sharing the clinical experience using Liftera as part of combination treatment strategies, particularly in Asian patients. Since we are already towards the end of the day, I'll keep this practical and clinically focused. My goal is to show how Liftera can go beyond being a standalone lifting device and become a structural anchor in multimodal rejuvenation, helping us create results that are natural, balanced, and sustainable. Because in combination therapy, the goal is not simply to do more treatments, but the goal is to combine treatments more intelligently. So when patients come in our clinics, I'll just look here. When patients come in from a clinic, they usually have a lot of concerns. It does not end with just the lifting and the sagging. They would always complain of wrinkles, pigmentations, textures. That's why there is a way to combine treatments to deliver the results that they want in the shortest span possible, because patients are not patient anymore. Okay? So there would be a demand for the natural outcomes, minimal downtime, and long-term collagen remodeling. We also have to meet our patients' expectations without overdoing it. All of us have different wants for facial lifting and contouring. Some of us want a V-line, some of us enhanced jaw, square jaw. Some of us want to keep volume on their faces also. So getting a plan, a holistic plan, is more advantageous than just doing the combination treatments. So we can lift and tighten while we renew and refine, while integrating regenerative medicine, strengthening the barrier, and of course, maintaining what we've built and prevention of degradation. Now, why Liftera is a very good fit for this combination treatments? They have already discussed the technology behind it, the thermal diffusion treatment, wherein we fire high-intensity focused ultrasound on different layers of the skin. And our colleagues earlier demonstrated how it really touches this mass layer and even the fatty tissues, depending on where you want the energy be deposited. So, according to Dr. A while ago from Malaysia, he wanted to focus on the ligaments. So with that, there would be some resuspension of the ligaments, and that would create the lifting effect over the days and over the weeks. With Liftera, you are much comfortable because the intuitive itself, the preface is just really straightforward. You know, you can adjust the level of intensity. To be fair, we do it in the clinic. I have done it myself without the anesthesia. With the Coolsonic, it's a new technology that they are promoting with the cooling. But since we have Liftera, what we do is we just cool the gel, and that serves as a distraction and a cooling sensation for the patients to tolerate the procedure. Not that it's not painful, but it's very, very much tolerable. So we do it without the numbing as to not irritate the skin. Also, with Liftera technology, we could address different layers of the skin, as I've mentioned earlier. I also use the 1.5 millimeter line and pen transducer for the orbital area. I'll show you some pictures later where you can literally see the effectiveness of these treatments. So this Liftera works because of the low downtime profile, the high compatibility. There's minimal to no epidermal disturbance or disruption also. And again, you can combine it on the same day depending on the patient's preference, availability of downtime, and the enhancing of the outcomes. And it can be combined safely with monopolar RF, with lasers, biostimulators, injectables, exosomes, and others. So why Asian skin? Of course, we're in Asia, and we have somehow a different anatomy versus that of other countries and races. Generally, we have thicker dermis, we have heavier soft tissues, especially on the lower face, and we want a well-defined mass layer as well. So with this in mind, we have to plan for a treatment protocol for each patient, because we all know that when patients come in, they want, and even you yourself, you want a tailored treatment plan for you. So this time, with Liftera, we can modify where you want to put the pulses, where you want the lifting happens, where you want to melt the fat, especially on the submental area, where you want to lift the brows using the pen transducer using 1.5 millimeters depth. So here's an example wherein, just like my colleague earlier, performed HIFU, Liftera, with Cool Face. That they call it Coolterra. So with that, we embedded HIFU using the 4.5 to 3.0, but we didn't go with the 1.5 as mentioned earlier. But with the monopolar RF, this actually takes care of the dermal layer of the skin and dermal remodeling. There's a difference between skin tightening and skin lifting. Tightening, for me, comes inwards. Your skin sticks to your bone, to that effect. So there would be lesser of the jowling also. But with lifting, it literally lifts your face. So it focuses more on the ligaments and this mass layer where the lifting happens. So when you do perform Liftera on certain areas, especially when focusing on the suspensory ligaments, and you do radio frequency, there you would see improvement in skin lifting and skin tightening as well. Also, as I've mentioned earlier, some patients come in with acne scars, pores, and pigmentation problems, not only on the face, but also over the ears, where we don't apply sunscreen, and over the neck as well. So with this, we can perform Liftera as, again, our anchor treatment protocol, and then we combine it safely with resurfacing laser. This one is with a 2910 nanometer cold fiber laser. And then we applied healers, exosomes, and even hyaluronic acid injectables. So again, this has no numbing. We didn't do this with the numbing. This was 2 treatments. Here also, we have 2 ladies, one wanting a rejuvenation on the face. I emphasized earlier that we use the pen for the under eyes also. There would be some stacking motions. You know that the interface of Liftera is very much modifiable in terms of the interval, the energy amount that you're depositing over that area, and this can actually help with the under eyes. If you want a non-surgical way of trying to limit or diminish eye bags and rejuvenate the periorbital area, the pen is a very good device to use because it can really address some of the crevices and hard-to-reach areas the line couldn't touch. So with this patient on your left, correct, on your left, we did the Liftera with some toxins. So again, on the same day, toxins of the forehead and the masseters. We also did some DAO toxins there. And you focus, just like the colleague earlier who showed you the results of submental, we focus on her submental area. That's why you see some jawline definition and chin augmentation effect to a certain extent. While our patient on your right, yeah. So this one doesn't want to change the look. She still wants a little of a full look, youthful look, because the fats on her face serves as a youthful anatomy. So it makes us look younger. So we don't want to destroy the fat on that area. However, we want to destroy fat over here to give you some definition also. So that's where we focus also. But she also wants glowing skin. So that's when we incorporated some exosomes and polynucleotides. So we didn't manage to flatten this area because when you tilt to your right and side profile, you want some youthfulness and plumpiness on your cheeks to keep you looking younger. So it's not always defeating the NLF or the nasolabial folds. It also depends on your patient's preference. So with Liftera, you can also define and make a strategic treatment plan, okay? So there could be, again, same-day combination treatments like I've mentioned earlier because there's low inflammation and with low downtime also. You can also stage this because not all patients are open to same-day treatments. So just do the Liftera as your anchor treatment plan, definitely they would see results in a matter of a week, sometimes even right after the treatment. If done correctly, they would see some orbital opening and lifting over the jowls. Uh, Skin tightening, it's an option again to do some cool face if you want, or cool sonic. And then you could also do this in a every month or every 2 weeks, depending on how much, again, you've deposited. Again, some patients are not really open to doing treatments aggressively. So we can actually decide for them, okay, for this session, you will do Liftera. After 2 weeks, you can come back. For the toxins, after 2 weeks, you can come back for some injectables. By the way, earlier, this one, we also incorporated some form of dermal fillers, HA cross-linked fillers, over the malar area just to lift and enhance the jowling. So that's again with the staged approaches. We can do the Liftera on the first meeting while they're developing, recovering from the HIFU. We can incorporate the ingredients needed to recreate the collagen for remodeling and skin enhancement. And then, of course, we have to factor in the skin sensitivity. That's actually an advantage in terms of staging the processes or the treatments, because you would avoid skin sensitivity, especially with patients with rosacea and pigmentation tendencies like ours, Asian skin. So again, with Liftera, we have to do proper patient selection always, because there are patients really that, let's be real, cannot be handled with energy-based devices no matter how frequent we do it. So let's refer to our colleagues in plastics if they need some liposuction and other modalities. By the way, we've also done Liftera with some mesolipo injections on the same day, right after the treatment. This actually did not swell at all. So you also have to choose intelligently. You have to know the ingredients of your injectables, whether they are compatible and are promoting some form of inflammation. Now, energy mapping. That's what I've been mentioning earlier. We want tailored treatment for our patients. So if you put more pulses on the temporal area, it may lift the brows, especially when you're using the pen. More pulses on the submental area using the line to melt some submental fat, and more pulses using the line over the ligaments to create a lift. We also have to do, of course, anatomical danger zones just for safety reasons for nerve endings and when you're injecting fillers also. And managing edema and inflammation, that's the use of your exosomes and other anti-inflammatory devices, and even an LED light can help. And we have to bear in mind, of course, preventing fat loss. Again, we don't want to melt fat. We have to reposition the fat from where they were used to be when we were younger. And again, avoid overtreatment depending on your patient's preference and openness to downtime. So in conclusion, combination therapy delivers superior rejuvenation outcomes. Liftera is highly versatile and multimodal with multimodal protocols. Asian anatomy, again, it is different for everyone. And proper sequencing, strategizing, tailoring treatments for our patient is always critical. And the synergy of these treatments will deliver sustainable results which will make our patients happy. Thank you very much.
Oh, thank you for your informative lecture about the combination of the treatment with the energy-based devices, also combined with the fillers, combined with the fractional for the skin texture. Okay, and now we have the move to the Q&A session. If anyone have the question, do not hesitate to ask our speakers. Okay, please move to your microphone.
Thank you for a wonderful lecture. I have a question about cooling system. In general, what is the maximum cooling temperature from baseline that does not interfere with the treatment, whether it is monopolar RF or focused ultrasound? This is my first question. Second question is that if the head, the cooling is broken and you have to treat the patient, how can I substitute the cooling with like a cooling ice, cooling gel, or ice bag, or a cooling air system? Can I replace that? That's my two questions.
Who want to answer? Is it okay?
So actually, cooling system for HIFU and monopolar is very different. As I told you, even though you have a cooling system, continuous cooling system for the contact for HIFU, the treatment depth does not change. But for monopolar RF, there's always reverse thermal gradient, meaning that the RF falls far away from the cooling into where the heat is, meaning that if there's a lot of cooling, the depth changes for monopolar RF. So that's why when we use the monopolar RF, normally when the cooling increases, the depth also increases. So if you want to actually target a little bit more superficial layer, then you would lower the energy for monopolar RF and then lower the cooling as well to get the maybe very superficial thermal rejuvenation. But for HIFU, the cooling system is only one level, meaning that it's guided to have negative 10 degrees, minus 10 degrees. And it's settled to that because they will try to cool the whole epidermis and without interfering with the depth of the thermal coagulation. And also, if the cooling is down, then I wouldn't recommend doing the treatment because it's set up to do that. But for HIFU, it's okay to do it, but just that the patient will have more pain. So you probably have to decrease the energy. But for monopolar RF, it's set up to have the right temperature, the right energy on the device. Meaning that if you use a different cooling system, definitely the treatment level will be different, and you might have complications that you don't want to have. Yes. Does it help? Or anyone can?
Well, in addition, also when it comes to HIFU, you're asking if we can use cryogenic air. Yeah, definitely you can. With the thermal diffusion treatment, it's programmed to deposit energy when it will reach about 60 to 70 degrees, where protein denaturation happens, and that's where your heat shock proteins are activated. So even if you do the cooling to enhance the patient comfort, it will not affect the results. And again, with the pen, you might not need, again, the numbing cream or the cooling with Liftera. Since we use a pen, there would be some dragging, there would be some back and forth movement, and that distracts the patient. The mechanoreceptors are activated, so therefore they feel less of the pain or the discomfort. It's actually not painful at all. I've tried it again and again. And with patients, they're very much tolerated. With the monopolar question, these machines are programmed not to work if the cooling system is down. Even with the traditional monopolar RF, 6.78 megahertz, it will not work. It will display error even with the cryogen being full. So it's volumetric heating. We're trying to reach a certain temperature to activate these HSPs. So therefore, if it's broken, the cooling, I will not do the procedure as well, correct?
As the lecture of the Dr. Tanjarin also mentioned about the cooling technique, do you have any suggestion about this question?
The same as I think if the cooling is broken, I don't recommend to do the monopolar IF because it's very heat, very dangerous to do without skin protection. And about the Liftera, that's TDT, thermal diffusion, that's safe, even no cooling. That's okay because the focus energy is only the focus point. Above and below is no heat. That's safe, no cooling need.
Okay, so as additional, doctor, the basic concept for cooling is protect epidermis only. So that's the basic concept. While we're using HIFU, actually it's creating heat tip. That's the concept of HIFU, right? And it's either smash or superficial fat layer. So it's little far from the epidermal. So adding some more excessive cooling for HIFU actually not be necessary. Adding a gel is already sufficient. It's different with monopolar RF because the monopolar RF are creating heat from upper to dermis. So we need to protect the epidermal. But again, I agree with you, doctor. For every monopolar RF, if the cooling doesn't work, then we cannot use the cartridge. So just replace it with a new one. That's my opinion.
Thank you for all the doctor. As Dr. Yesin said, the HIFU is no need with the cooling gel or cooling method, not like the RF, monopolar RF. So we have to divide the energy weight device to their own method. And even the complication is come from the heat, but you have to concern about the result also of the HIFU. Okay, run to the next question. If anyone have the question, please do not hesitate to ask us.
According to your experience, may I know the ideal treatment interval for the lift terror and also for the crude terror?
Anyone want to answer about the interval? Yes.
Interval treatment of Liftera and Cultura, I do in the same time,
No.
2 months or
For
4
lift
months.
terror, how many months do you do usually? And also for crude terror, how long is the interval?
Actually, there is many protocol for the Cultura and Liftera. So we can do the combined treatment in one session or even split the session. Anyone had the recommendation about the treatment program of the Cultura?
Okay, so for, in my experience for combination Liftera and Coolface, we name it Cultura combination, we do in the same time, in the same session. So it needs to be retreatment again. Usually I tell my patient about 2 until 3 months. As theoretically, it can set it up to 6 months. But my patient usually I have my patient in sort above 50. So if I wait until 6 months, it will be no, like this one. If we creating a heat in the multiple layer, doing multiple times will create a better result. So because the collagen's improvement, the skin quality improvement, and the tightening improvement. So during the time doing perform this both treatment will create a better result. But patients also need a quote unquote a rest time. So for me, in my experience, the rest time ideally 2 until 3 months. Most of them are 3 months. Is in my experience.
And for the additional information, because I have 2 machines, so I do the 2 machines in the same time. But if you want to separate, it not depend on the time, because you can appointment the patient to do Liftera today and next week to do the cool face. But I generate the protocol to do the same machine in the same day. But about the maintenance, how about the maintenance? Frequently, I appointment 4 months. But if the chubby face, 2 months, because we need more density energy.
What about Liftera only? What is the interval between the first session and the second session of Liftera?
Because collagenesis is take time, you need to wait to see your patient result for the lifting, but immediate lifting you can see is 20% now, right now. But after in the chubby face, the same 2 months. And for the thin skin, but thin face, I prefer cool face. Monopolar F because cool face is make the skin more plump. It's suitable for the thin people, but if the chubby 2 or 4 months, you can appointment freely. It's not right or wrong. It's adjust by yourself and observation of your customer.
Okay, now I will summary of your question that she asked about the HIFU machine. If can we do only one machine in one charm, and how long of the interval of the treatment? And I want you to mention about the chubby face protocol and also thin face protocol for the clients. Anyone want to answer?
Want to share?
Well, again, with Liftera, we do sometimes monthly protocols, but this is again depending on the patient's profile. If the patient needs more fat melting, I would do monthly, but I would be careful with my settings. So you have to clinically assess the patients also. Your question regarding Liftera, if you do Liftera today, when can you do cool phase? I would agree with doctor about 3 months, because as collagen maturation takes time, usually in about 2 to 3 months, and regenerative properties depends also with age. So there would be some cases where you will have to wait a little longer for the skin to recover, because you don't want to damage a damaged or recovering skin at that point.
Thank you.
Okay, Lanchu. Another question. Do you have any one last question for us? Okay, thank you.
For Kutera, I'm using both devices in the same day. I have one celebrity client. I do monthly interval for 2 times. I plan to do monthly for 3 times. And can you give an opinion for maintenance?
It up to the patient responsible, because collagen synthesis take
Yeah.
time. Yes, you can wait for 2 months or 3 months and repeat again. But about the aging, if your patient is more aging, you need more frequent to narrow the interval.
Yeah.
And you can extend the interval when your patient is good collagen production. You can adjust by yourself by your observation.
Thank you.
So actually, for HIFU, I would recommend to do it after 3 months period. But if you're celebrity, you have to go to a monthly treatment, right?
Yeah.
Then I would use the monopolar RF more often, because in general, in studies, they say that after 2 weeks, you can do second session is okay. It's accumulative. So even after, for monopolar RF, actually the energy doesn't go up as high as the HIFU. The temperature doesn't rise up as much. So meaning that HIFU, when it goes up to 60 to 70 degrees, is actually creating small scar inside the tissue. So it needs time to heal. So if you give more scar more often, actually there will be actually more scars, more fibrosis, which you don't want. But monopolar RF, if you don't use too many shots, then you could have a little bit of like small rejuvenation over time, and that one will be accumulated after 2 weeks is okay. So 1 month period is still okay, but I would decrease the shots.
Yeah, I HIFU shot line with line 4.5, 50 line each side, and pen applicator 4.5, 1,500, with 3.5 pen 1,000, and for upper face 1.5, 500. With 1 month interval.
But normally, suppose if I do it together at the same time, actually, if I use monopolar RF, then I don't use usually 1.5. I only use like 4.5 or 3.5, and then combine with monopolar RF.
Yeah. Thank
So
you.
why? I think about the coagulation temperature, right?
And also because of the cost effectiveness, maybe, because actually monopolar RF is more bulk heating, giving more larger area of energy in the dermal layer, but it cannot go up to the subcutaneous, and the SMAS layer will be energy will be very small. Only about like 20% will go to SMAS layer for monopolar RF. So I would use HIFU for the deeper parts and the shallower for monopolar RF.
Okay,
Thank you.
thank you. Any comment from the Dr. Yesin?
Okay.
just I agree with Dr. Park actually. When, like I said before, that monopolar RF, we come into the inflammatory pathway, which is it need to convert from inflammatory to anti-inflammatory, which is it takes 2 weeks. So we can make another treatment in 2 weeks. I think this will be suitable, and it enhancing the skin quality by the time. That's
Okay, thank you. And lastly, I would like to share any tip or trip for audience one by one.
Oh, okay. Lady
Maybe
first.
combination treatment or the tick that you make you expert on the evidence-based machine on this program.
Because I work with patient with more aging, so lifting and transformation harmony is the most favorable. So because they need many method to make younger. So I start with Botox, then filler for the deep structure, and PLLA before to do the machine, because I need the PLLA to setting in the dermis, and then I push the energy after to promote the PLLA. That
Good
much.
point. Thank you. Okay, Dr. Yesin.
okay. Since I work in anti-aging field, and I'm facing a lot of patients with hyperimmunity and get worse side effect because of treatment. Like we using PLLA or PCL, it should be okay for a certain patient, right? But for a hyperimmunity or autoimmune patient who doesn't know that he or she had autoimmune, it can cause a trouble because the inflammatory become much longer than we expected. So for my first patient, I'll always choose the safest modality, like this using device. For me, creating heat and stimulate the natural inflammation pathway, it will be more safe than we add outside material to the body. That's what I believe in. And so choosing device, especially for my first time patient or for my patient that suspectly have a immunity problem, I better using a device compared to injectable. That's my opinion.
Thank you. Next to Dr. Park.
My tip is that normally, because we have a lot of modalities that we can use in the clinic, so I don't recommend using only one treatment for only one patient or only one objective, because we can use too many other different modalities to achieve better result and to decrease complication. For example, I agree with doctor doing the PLLA before, because I tell my patient that your collagen is making, you need a collagen ingredient, and also you need a factory to work. But when your aging process is a lot, then your fibroblasts will be inactive. Then you need some biostimulators to wake up your collagen factory to work, and then give energy with heat, with energy-based devices to enhance the effect. So I would do biostimulators like 1 or 2 months prior to doing the energy-based device, and then do energy-based device afterwards. And as I told you, I don't want to give too much scars in the face, because tightening and rejuvenation and scarring is like just in between. So if you put too much, it becomes fibrosis. But if you do it in the right way, it becomes rejuvenation. So you have to always account that you can cross over in between.
Yeah, so for last, I think, and summarizing everything, it's going to be up to your clinical evaluation and approach. You have to do facial mapping. So when a patient comes in, gaunt looking, thin skin, I would go with doctor that I would do PLLA or other stimulators for the meantime. Let's bank some HA, let's bank some collagen before we even do an energy-based device. Versus someone who comes in with a chubby face, I would do directly an energy-based device. So it's not, there's no right or wrong here, but you just have to really intelligently assess the patient's needs and concerns, and let's move forward with the results that they are giving us back, because it will depend on how their bodies will react to our treatments. So it's also a matter of trying to make the treatment synergistic, but at the same time, know when to hold back.
Okay, thank you for your informative lecture from our speaker. And now the end of the session. Thank you for joining us today. Thank you.